Sleep difficulties in children with additional needs. This presentation is for parents and carers who are concerned about their children's sleep. What happens if we don't get enough sleep? Most of us know what it's like to have a bad night's sleep. We know this can affect how well we can cope with what we have to do the next day. Luckily for most of us, if we get a decent night's sleep the following night, we can get back on track. Some of us, however, know what it's like to regularly experience lack of sleep and the toll this can take on our emotions and the ability to cope with everyday tasks. As parents, we know and accept that we will experience times and maybe even long phases of sleep deprivation as our children go through different phases and stages in their development. Children with special educational needs, however, may experience more frequent and more significant difficulties with sleep, and so parents of children with additional needs may benefit from learning some additional strategies to help their children sleep better. In this presentation, we will be giving some ideas for parents to try to help their children sleep better. Sleep is as important for children as food and water, and we need to put as much effort into helping children sleep well as we do to what they eat and drink. If children sleep well, they will be able to manage their emotions and behaviour, pay attention and listen, and they will perform better at school. Their overall general health will be improved and they will be better able to fight off illnesses. Why do some children have sleep difficulties? There are lots of reasons why children have sleep difficulties. There may be physical or medical reasons that stop children sleeping well. They may have, for example, breathing difficulties because of asthma, or bedwetting or seizures may wake them up. We know that children who have ADHD often struggle with sleeping. Discomfort because of eczema, constipation or gas can all cause a child to have poor sleep. If a child is on medication, this can affect their sleep. If a child has visual or hearing difficulties, this can also cause sleep problems, as waking in the night can be disorientating for a child. If a child suffers from anxiety, this can result in sleep difficulties too. Children can also be sensitive to noise, temperature, light, smell, or touch, and various things, even how their nightclothes or blankets feel or sound, can unsettle them and cause sleeping difficulties. So all of these things need to be thought about and may be adjusted to see if they make a difference. What children eat and drink can also cause sleeping difficulties. Milk and higher protein foods or drinks can aid sleep, but foods like white pasta and bread and foods high in sugar can cause us to wake in the night. So it's a really good idea to think about what children are eating and drinking in the evenings. There may be behavioural reasons for a child's sleeping difficulties. It may be they never settled into a routine and never learned to self-settle. It may be out of habit. It's just what the child or parent has become used to. It may be the child is used to getting extra attention by resisting going to bed at night. Sleep difficulties are also caused by some kind of sleep disorder, such as sleep terrors or nightmares, or sleepwalking, rocking, or sleep apnea, where someone stops breathing and wakes themselves up. How to help improve children's sleep. If your child has difficulties sleeping, don't give up hope, as there are lots of things to try. The main thing is to put a plan in place, stick to it, and keep going. First, identify the problem. The first thing to try is to identify the problem. Keep a sleep diary for 2 weeks. Note what time you put your child to bed, how long it takes them to get to sleep, what time they eventually go to sleep, how often they wake up, and so on. Record what you did to try and help and note what seemed to work, even if it was just a little bit. Then make a plan to use the best strategies more often. Think about the transition from daytime to bedtime. Research clearly shows that exposure to blue light is really bad for sleep. So try really hard to limit the use of technology at least 1 hour before a child's bedtime. Create sleep associations. For example, a child will learn that turning off computer games, getting into a warm bath or shower, getting on clean pyjamas are all associated with preparing for sleep. Establishing a bedtime routine is really important, and it's never too late to get a routine in place. This slide shows a suggested evening and bedtime routine. You may need to repeatedly put your child back to bed and say, "Good night, time to sleep." Avoid eye contact, talking, or getting into conversation, and stay calm. Does your child have difficulty sleeping alone? If so, move away gradually. Make sure you have established a good bedtime routine first of all. Start by laying beside your child on the bed, but don't get into the covers. Lay on top of the covers. Don't talk to your child or look at them. Just say, "It's time to sleep," and I will lay next to you. Stay with your child for at least 15 minutes after they seem to have gone to sleep, as they will only be lightly sleeping at this time. The next stage of this technique is sitting up next to your child while they drift off. Then move to sitting up, but with your feet on the floor. Next, when they are used to falling asleep with you doing this, move to sitting next to the bed. Very gradually move further and further away, by the door, sitting outside the door, and eventually in another room. If your child wakes in the night, try to work out what the issue is. Are they hot, cold? The room may be too light, or they may be thirsty or have wet the bed. Teach your child to do what they need to do for themselves, and especially to stay in their room. If you do need to go into your child, keep communication and eye contact to a minimum, and don't turn on the light. Follow the same pattern as at bedtime, and this may mean moving away gradually again, if this is what you have been doing. Is your child waking up at the same time every night? If your child is waking up at the same time every night, try interrupting this pattern by gently disturbing 30 minutes before they would usually wake up. Just give them a bit of a tap or a nudge so they react, but not so much that they wake up. This can be just enough to disrupt the pattern of waking that they have gotten into. What do you do if your child does not fall asleep until very late? Try the faded bedtime approach. First, work out what time they seem to fall asleep within 20 minutes of going to bed. Gradually bring bedtime forward of this by 15 minutes. If the child does not go to sleep within 15 to 20 minutes, remove them from the bed for 30 minutes to increase their motivation to fall asleep. After 30 minutes, return the child to bed and leave them for 15 to 20 minutes. And if they're not asleep, remove them for 30 minutes again and repeat this cycle. Here is an example of the faded bedtime routine. See how it can take about 18 nights to get a child's bedtime from 10:30 p.m. to a more reasonable 8:30 p.m. There are a lot of other things you can try. Try not to let your child take naps in the day. Try relaxation like music, massage or guided imagery. You can find recordings on YouTube. Maybe create a social story about bedtime and sleep and read this to your child. Consider giving bedtime passes if a child has difficulty going to bed. Assess first how frequently they are getting up and agree a contract. Gradually reduce from, for example, 3 passes to 1 pass to no need for a pass. Maybe run this alongside a reward system. Reward in the morning for remaining in bed, not necessarily for not going to sleep. And use a visual system to monitor progress, like a star chart that you keep on the fridge. Here are a few things to consider. Choose a good time to try new strategies. Don't begin during a special holiday or event. Remember that the problem may get worse before it gets better because you are trying new things. Don't try out new ideas if you or your child are unwell or feeling a bit low. It may be that you need to change furniture or rooms, and it may be that you need to support other members of the family to understand what you are trying to do. Reward other children who are having to make sacrifices or who are struggling because one of the children are having difficulties sleeping. Remember, do talk to other people and ask them for ideas. Warn your neighbours that you are trying a new technique to help your child with sleep, and so there may be some disruption. Make sure all the adults are being consistent and back each other up. Don't give in. You will only train your child to get worse if you do. And be patient and consistent, and don't get frustrated if what you're trying doesn't seem to be working or is taking a long time. Most important of all is to look after yourself. Don't panic and get as much rest as possible. Ask for help if you need it, and remind yourself that things will get better. Here's where you can get some more help.